Have you ever wondered why some people seem to struggle with their weight, blood pressure, and blood sugar all at once? It might be more than just a combination of factors. It could be metabolic syndrome. But what exactly is metabolic syndrome, and why should it matter to you? This condition, often unnoticed until it's too late, is a cluster of risk factors that can significantly impact your health. From high blood pressure to abnormal cholesterol levels, metabolic syndrome poses a serious threat to your well-being. Understanding this syndrome is crucial because it not only affects your daily life, but also increases your risk for severe health conditions like heart disease and diabetes. In this video, we'll unravel what metabolic syndrome is, explore its causes, and discuss why recognizing and managing it is so vital. Let's dive in and uncover the essential details. Make sure to stay until the end to find out all the best information. And remember, at Beyond Living, we provide the best information and actionable and functional guides for all facets of healthy living, vitality, and fitness. Also, check out the awesome products that are running exclusive, limited time deals just for our viewers here at Beyond Living in the description and in the top pinned comments that we recommend for all our viewers for vitality, healthy living, and fitness. Like, comment, and subscribe as it greatly helps the channel. Metabolic syndrome is a complex health condition that arises when a person has a combination of several risk factors that increase their likelihood of developing serious diseases. These risk factors include abdominal obesity, insulin resistance, high blood pressure, and abnormal lipid levels. Abdominal obesity. This is often identified by excess fat around the waist. It's not just a matter of appearance. Abdominal fat is linked to several health problems. If your waist circumference exceeds certain measurements, typically more than 40 inches for men and 35 inches for women, it could indicate abdominal obesity. Insulin resistance. Insulin is a hormone that helps regulate blood sugar levels. When your cells become resistant to insulin, your blood sugar levels can rise, leading to prediabetes or type 2 diabetes. Insulin resistance often goes hand in hand with other components of metabolic syndrome. High blood pressure. Also known as hypertension, high blood pressure is a common component of metabolic syndrome. It strains your heart and blood vessels, increasing the risk of heart disease, stroke, and kidney problems. Blood pressure readings consistently at or above 130/85 mmHg are typically considered high. Abnormal lipid levels. This refers to irregular levels of cholesterol and triglycerides in the blood. Elevated triglycerides and low levels of HDL, the good cholesterol, or high levels of LDL, the bad cholesterol, can contribute to the buildup of plaques in arteries, leading to cardiovascular diseases. Diagnosing metabolic syndrome involves identifying these risk factors and measuring their levels through various tests. By understanding each component, we can better appreciate why managing and treating metabolic syndrome is essential. Next, we'll delve into the causes and risk factors of metabolic syndrome. Why does it happen? And what can increase your likelihood of developing it? Let's explore these questions to gain a clearer picture of the syndrome's origins and its potential impact on your health. Metabolic syndrome doesn't just appear out of nowhere. It's influenced by a mix of genetic, lifestyle, and environmental factors. Understanding these can help identify why some people are more prone to it than others. Genetic predisposition. Your genes play a significant role in your risk for metabolic syndrome. If your family has a history of diabetes, heart disease, or obesity, you might be more likely to develop these conditions yourself. While you can't change your genes, knowing your family history can help you take preventive steps. Lifestyle factors. Poor diet and physical inactivity are major contributors. Consuming a diet high in processed foods, sugars, and unhealthy fats can lead to weight gain and insulin resistance. Similarly, a sedentary lifestyle, spending long hours sitting with little exercise, can exacerbate these issues. Incorporating regular physical activity and a balanced diet can significantly reduce your risk. Environmental influences. The environment you live in can also impact your health. Stress, lack of sleep, and exposure to unhealthy food options can contribute to metabolic syndrome. Chronic stress, for instance, can lead to hormonal imbalances that affect your weight and blood sugar levels. Comorbidities. Conditions such as type 2 diabetes and cardiovascular disease often accompany metabolic syndrome. These health issues can interact with each other, making the management of metabolic syndrome more complex. Understanding these causes and risk factors is crucial for prevention. Next, we'll explore how metabolic syndrome is diagnosed and what symptoms to watch for, helping you identify it early and seek appropriate treatment. Metabolic syndrome often develops silently, with few noticeable symptoms until significant health issues arise. Recognizing the signs early can make a big difference in managing the condition effectively. Common symptoms. Many symptoms of metabolic syndrome are subtle and can be easily overlooked. These may include unexplained weight gain, particularly around the abdomen, and persistent fatigue. People may also experience frequent headaches, blurred vision, or difficulty sleeping. However, these symptoms alone aren't definitive indicators of metabolic syndrome. Diagnostic tests. To diagnose metabolic syndrome, healthcare providers use a combination of tests and measurements. Blood tests are crucial for assessing levels of glucose, cholesterol, and triglycerides. Elevated blood sugar levels can indicate insulin resistance, while abnormal lipid levels can reveal dyslipidemia. Blood pressure measurements help identify hypertension. Body measurements. Measuring waist circumference is another important diagnostic tool. Excess abdominal fat is a key component of metabolic syndrome. A waist circumference greater than 40 inches for men and 35 inches for women is a common threshold for concern. Diagnostic criteria. Health professionals often follow specific criteria for diagnosing metabolic syndrome, such as those set by the American Heart Association. According to these criteria, a person may be diagnosed with metabolic syndrome if they have at least 3 of the following. 1. Abdominal obesity. 2. Elevated blood pressure. 3. High fasting blood glucose. 4. High triglycerides. 5. Low HDL cholesterol. Recognizing and diagnosing metabolic syndrome is crucial for timely intervention. In the next section, we will explore the health implications and complications associated with this condition, emphasizing why addressing it early is so important. Metabolic syndrome isn't just a collection of numbers on a medical chart. It has significant health implications that can affect your quality of life and longevity. Understanding these risks can underscore why addressing the syndrome is so vital. Cardiovascular disease. One of the most serious consequences of metabolic syndrome is its strong link to cardiovascular disease. Elevated blood pressure and abnormal cholesterol levels contribute to the buildup of plaque in the arteries, increasing the risk of heart attacks and strokes. This is due to the strain placed on the heart and the potential for blood clots to form. Type 2 diabetes. Insulin resistance, a key feature of metabolic syndrome, can progress to type 2 diabetes. When the body's cells don't respond properly to insulin, blood sugar levels rise, leading to diabetes. This condition requires lifelong management and can lead to other complications, such as nerve damage, kidney disease, and vision problems. Impact on quality of life. Beyond these serious health risks, metabolic syndrome can affect your day-to-day life. It can lead to fatigue, difficulty concentrating, and decreased physical fitness. The syndrome can also contribute to mood swings and depression, impacting overall well-being. Additional risks. Metabolic syndrome can also increase the likelihood of developing other conditions, such as fatty liver disease and sleep apnea. Each of these issues can compound the overall health burden. Understanding these potential complications highlights the importance of early diagnosis and management. In the next section, we'll discuss practical strategies for preventing and managing metabolic syndrome, focusing on lifestyle changes and medical interventions that can make a difference. Managing metabolic syndrome involves a combination of lifestyle changes and, when necessary, medical interventions. Taking proactive steps can significantly improve your health and reduce your risk of serious complications. Lifestyle changes. Adopting healthier habits is the cornerstone of managing metabolic syndrome. Start with your diet. Focus on eating a balanced, nutrient-rich diet. Incorporate plenty of fruits, vegetables, whole grains, and lean proteins while reducing intake of processed foods, sugars, and unhealthy fats. This approach can help manage weight, lower blood pressure, and improve cholesterol levels. Regular physical activity is equally important. Aim for at least 150 minutes of moderate exercise per week, such as brisk walking or cycling. Exercise helps lower blood sugar levels, reduces body fat, and improves cardiovascular health. Weight management. Losing excess weight, especially abdominal fat, can significantly impact metabolic syndrome. Even modest weight loss, around 5–10% of your body weight, can lead to improvements in blood pressure, glucose levels, and cholesterol. Medical interventions. In some cases, lifestyle changes alone may not be enough. Medications may be prescribed to manage specific components of metabolic syndrome, such as high blood pressure or high cholesterol. Regular checkups with your healthcare provider are essential to monitor your progress and adjust treatments as needed. Early intervention. The earlier you address metabolic syndrome, the better your chances of preventing complications. Routine screenings and awareness of your health markers can help catch any issues before they become severe. Metabolic syndrome is a serious health condition with far-reaching effects, but understanding and addressing it can make a significant difference. By recognizing its components, abdominal obesity, insulin resistance, high blood pressure, and abnormal lipid levels, you can take steps to manage and prevent it. Embrace a healthier lifestyle through balanced eating, regular exercise, and weight management. And don't hesitate to seek medical advice if needed. Early intervention is key to reducing risks and improving overall health. Take charge of your well-being today by making informed choices and staying proactive in managing your health.